My name is Karl Lieb. I'm the Salt Lake City Fire Chief. So I am ultimately in charge of all emergency response regarding patient care or fire incident response or anything else that occurs within the Salt Lake City boundaries. We have a fire department that encompasses 356 personnel, 14 stations, and we're strategically located throughout the neighborhoods. It's not quite business as usual for us. We're operating in a completely different environment. But I think we give the city a sense of, of control, and we're going to get through this together. And I think knowing that when they call 911, if they need someone to respond to help them out, we're going to be there for them. We're going to be prepared to take care of whatever issue they're having.
How are we as a city working to take care of our firefighters and our first responders in such circumstances?
Well, I think the city's doing a great job of trying to anticipate the needs of all their first responders, from police officers to dispatchers to firefighters. So we're looking at different options for different types of leave, paid benefits regarding potential isolation or quarantine for our members, and ongoing medical conditions that are yet to be determined, from COVID-19. So I think they're anticipating those things. I think they've been very proactive, and the communication has been very good between the public safety branches and the mayor's office.
For members of the public, what can they do to help firefighters during this time specifically?
Well, number one, I think they have to understand that this is real. This is a worldwide pandemic. It's not quite the same as the flu. It has different parameters, different onset, slightly different symptoms. To help us out, essentially stay home, stay safe, has been directed by the county and Salt Lake City, and allow the first responders to do their thing. I think the only way we're going to eradicate this situation right now is to identify those that do have the virus and then quarantine them. And then we're just going to have to ride this out. It's going to take a little while, but we'll come out the other end and we'll be okay. And that's the best advice I can give people. And to separate socially, we need to be physically separated, but we don't need to be absolutely positively separated, right? We have many means of communication available to us now. Just do not make this more pronounced than it needs to be by being close to each other.
What steps does the fire department take if, say, a member of the public calls 911 because they need help and the fire department needs to issue a response? How important is it for residents to let dispatch know if they're feeling symptoms?
Well, it's very important, Brian. Right now, we are changed our mode of operation a little bit. We do get that kind of information over from our dispatchers. In fact, the dispatchers will ask people, do you have any flu-like symptoms? That's all we need to know. If the answer is positive, yes, we're going to come in there definitely with a mask on, with glasses, potentially a gown, depending on the situation. And we may ask you, the patient, if it's a medical call, to wear a mask as well to protect us. And rather than have 4 firefighters assessing you at one time, you may just have 1. And they may also ask you to come outdoors to meet them when they arrive on scene, if you're able, because that enables us to do the assessment in fresh air, without the closed quarters. The danger of communicable diseases within the buildings are much greater than they are outside. So those are the kind of things we're asking our residents to do for us. And they've been very receptive to that. I have to say, the people of Salt Lake seem to understand the challenges that we're facing as first responders, and they're doing their best they can to alleviate some of those concerns.
Where can residents go to get more information about the fire department response, about the emergency management response, and just where can they go to get reliable information about COVID-19 as it relates to your operation?
They can go to our website, SLC Fire. We have an abundance of COVID-19 information on there. You can also go to the Salt Lake Health Department website, and Utah State Emergency Management website as well. Has a lot of COVID-19 guidelines, directions, advice, and just general information that separates facts from the myths out there.